I'm Dr. Brent Barlow, naturopathic physician in beautiful Kelowna, British Columbia. Many patients will inquire about tendonitis and what are the natural treatments that we can do for tendonitis type of issues. And first of all, we really want to take a look at what type of tendon is being injured, how is the integrity of the joint, and how is that all playing in together. Some of the most common tendon injuries would be tennis elbow, golfer's elbow, Achilles tendonitis, amongst a whole myriad of other types of issues. We'll always look at the joint itself to see, is the joint stable? Is this just a tendon issue, or is there some kind of instability in the shoulder joint that's allowing the tendons in the external rotators to have some kind of difficulty as well? So really important to do a proper diagnosis. Sometimes tendon issues are on the simpler side where there's a slight tear in the attachment where the tendon is attaching to the bone, and sometimes there's a more complicated type of history as well too, where it involves all the way from the neck down in through to the shoulder and into the elbow. And the Achilles can be very similar as well too. You know, why did my Achilles have this slight tear or slight sprain in it? Is it actually a hamstring issue? Is it a knee instability issue? So really important to first of all get that proper diagnosis so we don't just jump into treating the local area and neglect all these other areas that are predisposing somebody to the tendon issue. The therapy we typically use to treat tendonitis would be prolotherapy. Prolotherapy is an injection technique where we're stimulating the body's immune system to regenerate that tendon tissue. We typically are using a dextrose-based solution with procaine and vitamin B12, and the way the solution works is we stick the needle right into the spot where the tendon is fraying or being torn. The injection will then stimulate a local influx of blood cells to the area, and these types of blood cells will see the new damage on top of the old, and they will then recruit the fibroblast cells. The fibroblast cells are the magic cells that come in and actually regrow the tendon tissue and bring that integrity back to its full form. Typically, most people will need somewhere between 3, maybe up to 6 sessions in order to get full regrowth of the tendon. And we're typically spreading these out anywhere from about 2 to 4 weeks, depending on the tendon and the nature of the issue. So that's how prolotherapy works. I hope you enjoyed this video. If you did, and if it stimulates any questions, feel free to email me at info@drbrentbarlownd.com. I'm happy to email back responses, and possibly your email question might stimulate a new video on that question. So I'm happy to do that as well too. I'm Dr. Brent Barlow, naturopathic physician in beautiful Kelowna, British Columbia.